Now, if you're a female and you've got saddlebags, this is something that comes up a lot. Many of my clients have approached me because they said, I want to build a butt, and they have the saddlebag look. And I always say to them, you know, in my experience, in terms of what I've seen happen with my clients, is that the saddlebag shape has to do with unused glutes. So if the glutes aren't firing properly, all the tissue that sits around the back actually just kind of almost sags out to the side. So we can change the shape of the leg if we can get the glutes to fire up properly. It'll bring all that tissue around to the back of the body and then lift it up so that it completely changes the shape of the leg. If you think about it, that kind of makes sense, because usually my clients that have got the saddlebag shape tend to be very flat in the glutes, which tells me again that the glutes are not switching on. So glutes should be quite pert. They should be the largest muscle, and they drive you forward. So they need huge amounts of strength for that gait, our propulsion. Now, women's hips, we know, are slightly wider than men. And so the angle between the thigh muscle and the knee in females is larger than that same angle between the thigh muscle and the knee in men. Okay, and that's called the Q angle. So you can see in the diagram, the Q angle in women is far greater than it is in men. So that means that we tend to be knock-kneed a lot of the time, or we pronate on the foot. So the tendency when I see a lot of females lunge or squat is that the knees come inside of the hips. This is always very interesting for me to see when I do an assessment, a physical assessment of a client, because I want to look at the positioning of their knee in relation to the hip. If that complex is not operating properly, typically, as I said, I'll see the knees drop inwards, but I often see women running. And what I notice is that when they land with a knee coming forward, so they land in a slightly knock-kneed position. The heels kick out to the side, not behind the body. And that tells me very often, I know the glutes aren't working properly, but it also means that the likelihood of knee pain is going to be extreme. Because if you think about all that force landing, essentially all that force is coming through the insides of the knee. So you're going to be causing problems on the inside of that knee. And so that's the thing that I tend to focus on most. And if I think about the kinds of clients that I have currently, most of them are dealing with some kind of tracking issue between the hip and the knee.